Okay, welcome to the live session of our show Sugar Smart Guys. I hope everyone is doing good. Today, the topic of our live session would be managing diabetes during pregnancy. I am your host Muskan Juneja, and I am very delighted to be here with you all today. Okay, you may all be aware of menopause. During this, a woman experiences a lot of hormonal fluctuations and imbalances, right? So, which can also affect our insulin sensitivity and sugar blood levels. In such a situation, it is important to understand how menopause can impact a woman's health with diabetes, right? To explain this, today we will be inviting Dr. Puja Sharma with us, and Dr. Puja Sharma is a renowned gynecologist and with over an experience of 15 years. She's the head of Department of Obstetrics and Gynecology at Amity's Daffodils Hospital in New Delhi. I will just invite her. Hi, hi, Dr. Puja. How are you?
Hello, am I audible?
Yeah, you are audible.
Yeah,
Hi, how are
cool.
you, ma'am?
Hi. Good. How are you doing?
All good, all good. Okay, so let's just start with the questions, right? Okay, the first question is, how do hormonal changes during menopause affect insulin sensitivity?
How the hormonal changes during menopause affects insulin sensitivity. So, hi guys, I am Dr. Puja. As mentioned, I'm a gynecologist practicing in Delhi South, and my clinic is by the name of Daksh Clinic, located at Hoskas. I am an MD Gynecology and FICOG FMA. So, it's my pleasure to talk about this topic because this is a relatively debatable topic. As the data that we have, hi, as the data that we, a very good evening to all who are joining in. The data that we have is still not that robust on this topic. So, two parts of your question. First is menopause, and second is insulin sensitivity. So, let's understand first what is the meaning of these two words, right? How menopause affect insulin sensitivity. So, what is menopause? Menopause doesn't mean cessation of periods only. Menopause means that phase of a woman's life when your ovaries are no more producing estrogen and progesterone, the two main hormones, right? So at this age, usually between the age group of 45 to 51, you may say, this is the age for menopause. Ladies, they begin a transition phase and then ultimately they land up in menopause. So it is not in a day, it is not in a week, it is a gradual process. And during that process, several changes happen in our body. The most important one being hormonal changes, which means the level of estrogen and progesterone comes down. So because of this, the insulin sensitivity is affected. अब मतलब क्या है insulin sensitivity is affected? Insulin is that hormone in our body which is responsible for sugar maintenance. डायबिटीज में जैसे प्रॉब्लम होती है शुगर की, तो बॉडी का शुगर मेटाबॉलिज्म मेंटेन करने के लिए ये एक पैंक्रियाटिक हार्मोन है. सो ड्यूरिंग मेनोपॉज ईस्ट्रोजन का लेवल कम हो जाता है एंड अल्टीमेटली ये हार्मोन इफेक्ट होता है. व्हाई? बिकॉज ईस्ट्रोजन level is responsible for many other functions in our body. Low level of estrogen leads to, agar if I'm being too medical, let me know, it leads to metabolic syndrome. मतलब body में बहुत सारी metabolic changes आते हैं, like change in sugar level, change in blood pressure, bone changes, fat distribution. Because of all this, ultimately the sugar metabolism is affected too. And this is what we call insulin sensitivity, which means the response of insulin to various cells in our body. Insulin करता क्या है, हमारे बॉडी में जो ग्लूकोज है, it allows that glucose to enter the cell. So insulin sensitivity means a kind of insulin resistance develop, which means insulin is there but the body is not able to use the glucose, and that's why the blood level of glucose start rising, right? So menopausal changes, they indirectly affect insulin sensitivity. If I'm clear, then thank you.
Yes, I guess everybody got their answer. You were pretty much clear. Okay,
Thank you.
cool. So the next question will be, how can women with diabetes manage their blood sugar levels during menopause?
How can women with diabetes manage their blood sugar level during menopause? Okay. So there are two things. First, a lady is not diabetic and she is going through menopause and then she develops diabetes. Second is, there is a female who is already diabetic and now she is 43, 44 plus and she is going through menopause. So I think we are talking about these ladies who are already diabetic and they are going through menopause, right?
Absolutely. Yes.
So what do you, okay. So when you are diabetic and you are going through menopause, then it depends on the type of diabetes that you have, whether you have type 1 diabetes or type 2 diabetes. Type 1 diabetes and menopause can be associated. There are various studies, though not, there are, what should I say, there are various research papers and materials that suggest that ladies who have type 1 diabetes, they undergo early menopause. Okay, so is there are contradictory data also, but there are few articles that support that if somebody is having type 1 menopause, you may face type 1 diabetes, you may face menopause early. Now, if you have type 2 diabetes, then what do you have to do? If you have type 2 diabetes and you are going through menopause, then there are chances that your diabetes may worsen during your menopause. Why? Because during menopause, the level of hormones are coming down. Your body is going through various changes. There is fat distribution. You must have heard many ladies saying that, मैं उतना ही खाती हूँ, but I don't know why am I gaining weight. है ना? You must have heard mummy saying that I eat that much only. Still, I'm eating one chapati. I used to eat one chapati before also, but now I am gaining weight. So it is not their fault. It is the menopausal transition which is partially responsible for that. Why? Because of low level of hormones, the fat is getting concentrated in the belly. There is central distribution of fat. Plus, what happens is that there is decreased energy expenditure, which means calories burn out नहीं हो रही है. Calorie body का metabolism slow हो गया है. Calories कम burn out हो रही हैं, fat distribution ज़्यादा हो रहा है, heart disease की tendency बढ़ रही है, bone metabolism slow हो गया है, bone thin होती जा रही है, and आपका glucose metabolism ऐसा है that during the period of menopausal transition you are prone to develop diabetes and there is various changes in the level of hormone. So if you are already diabetic and you are going through menopause, just remember that do check your blood sugar very frequently. Start checking your blood sugar on a regular basis because you may face fluctuations. Now suppose you are having menopausal hot flashes. Okay. Now it is very difficult for you to differentiate ki whether you are having low glucose level because of which you are having excessive sweating, palpitation, burning, or it is because of menopausal hot flashes. It is very difficult. Sometimes the symptoms are overlapping. You cannot understand कि आपको ये menopause की वजह से हो रहा है या diabetes की वजह से हो रहा है. So during menopause, a diabetic lady must measure her sugar regularly. She should be vigilant enough. She should be active, lots of exercise, eating healthy diet, because she may face change in level of the medicine, the need for the medicine. That suppose she's taking insulin, there may be change in the requirement of insulin in her body during the menopause phase. She may need to readjust the doses. So the only advice that I would like to give any diabetic female who is undergoing menopausal transition is that live a healthy lifestyle, especially during your menopausal transition, and monitor your BP, monitor your sugar, monitor your day-to-day metabolic changes. If you can, visit a doctor on a monthly basis and get yourself checked, because this is the time when you need to readjust the medicine. Okay?
Yeah, very crucial time for everybody, right?
Any lady who is going through menopause.
Absolutely. Okay, moving ahead, how can therapies like hormone replacement therapy impact the insulin sensitivity for women with diabetes?
So I think many of us are not aware what is hormone replacement therapy.
Yeah.
It is also known as MHT, menopausal hormonal therapy, which means कि your body is not producing estrogen and progesterone, and to take care of the side effect because of decrease in level of these hormones, we give medicine. So this kind of therapy in which we give estrogen and progesterone artificially in the form of medicine, as it is not produced in the body, is known as menopausal hormonal therapy. Now, the good thing about this therapy is that it has a positive effect on glucose metabolism, glucose homeostasis, which we call. मतलब ये body का sugar वाला metabolism, it keeps it at a decent level. It gives you a pro effect. आपका sugar well maintain होता है if you are taking replacement therapy. But the gray side of the treatment is that it has a negative effect on, relatively negative effect on your heart metabolism, cardiovascular metabolism. So you have to be very precise. Your doctor need to individualize. You are diabetic, then you can go to your doctor and ask about, doctor, hi doc, can I go ahead and take hormone replacement therapy? Your doctor will do a risk assessment for your heart disease, whether you have high chances of getting a heart disease or not. If you have a low chance, then you may be offered hormone replacement therapy. Okay. So ladies with diabetes who are at low risk of heart disease, who are relatively thinner, who have no family history of any heart disease, no personal history of any such disease, they can be offered hormone replacement therapy, and believe me, their glucose metabolism recovers. Show a positive shift when they were not on hormone therapy, and now when they have started their hormone therapy, because hormone therapy, it improves your sugar level. Your requirement for diabetic medicine decreases. मगर एक बात ध्यान रखने की है कि आपको कौन सी हार्मोन रिप्लेसमेंट थेरेपी दी जा रही है. उसमें भी your doctor will decide कि which estrogen and which progesterone to be given. So go meet your doctor, discuss about these things. Just don't go by what you have read that, okay, now I have diabetes, I can go ahead and take hormone therapy and my diabetes will be fine. No, get a physical assessment done and then go ahead. And if your doctor feels that you are good to go, then go ahead and take treatment.
Perfect. Okay, so I think everybody is clear that before taking any step further, right, you should just go and check it with your doctors once. Okay, perfect. Doctor, before moving ahead, I would just like to inform you and our audience about our diabetes community on WhatsApp. So we have a particular diabetes community, and in case if you wish to, anybody from the audience wishes to join it, you can find a link in the bio. Also, you can just type a message saying that I am in, and we'll definitely share a link with you over a DM, right? Okay, moving ahead, what factors should women with diabetes keep in mind before undergoing such therapies?
As I mentioned, they should keep in mind to share with their doctor what other disease they are having, what other medicines what they are taking, right? Just remember to tell your doctor that, doctor, I have high blood pressure, or doctor, my family history suggests that my mother was having so and so disease, or somebody in my family, or I had a similar episode when I was young. Anything which is medically significant, discuss with your doctor so that your doctor can assess what is your risk for developing heart disease. And if you are a low risk and healthy, otherwise no other problem medically, then you can go ahead and give a try for for menopausal hormone therapy.
Okay, perfect. Okay, we have a question related to the same in the comments that says, any dietary recommendations for the same?
Certainly, the first line of therapy for any diabetic lady who is undergoing menopause is lifestyle modification only. You have to, medicines are all secondary. They come into play once your dietary modification has not given you adequate result. When I say dietary modification, what do I mean? Eat healthy. Eat healthy means eat food which contains less saturated fat, more of unsaturated fat, fruits, vegetables, whole grains. Try taking lots of vitamin D. Take vitamin D supplements. Discuss with your doctor and take calcium and vitamin D supplements. Try exercising at least, if I'm not wrong, 5 days a week, 45 minutes each. So this is the level of exercise that you should do. Limit your sugar intake. For ladies, I can say that 5 to 6 teaspoons of sugar in a day is more than enough. It is more than enough. Okay. So limit your sugar intake, and yes, try to limit smoking and alcohol. If you have any of these habits, then do quit them, because all these things will cumulatively going to show a negative impact on your glucose metabolism. and overall health too, because this is the time when you have several metabolic changes. This is the metabolic syndrome, the age for metabolic syndrome. Lifestyle modification is always prime. Go ahead with lifestyle modification and you will be fine. Believe me, you will cut short your medicine requirement to a significant level. So live a healthy lifestyle, exercise regularly, drink lots of water.
Amazing. Okay, there is one more question that says, a lady saying, I am undergoing menopause. Are there any specific exercises also that can help? Like, can you recommend the specific
Yes.
exercises?
Yes, you can go ahead with low impact exercise. Initially, don't go ahead and push yourself hard. Start with stamina building exercising. As per the recommendation, ladies who are more than 40 plus must go for muscle strengthening exercise. You need to build your muscle mass. So by saying so, I mean that you can simply start with walking. If you have never done any other exercise, then you can start with walking. Once you have developed a stamina of walking without any panting or exhaustion for 35-40 minutes, then step up to other modes, like you can go for a Pilates, you can go for yoga, you can try other therapies. I won't say gymming per se, but gradually you can step up to weights. So there are various forms of exercise that you can undergo according to your body structure, what you can do best. So just don't go by what people are doing. If some of your friend is doing a particular exercise, and maybe somebody is good at dancing, I would suggest you go for Zumba. You go for a Pilates, where it is not just exercise, where it is something that you like also doing. So swimming, for that matter. So there are many exercises that you can start with. Individualize. See, and menopause, see, the word menopause is me no pause. That means this is the age when you should not pause. So the word says me no pause, right? So groom yourself, and don't think that menopause has something extra that you now, oh my God, the menopause has set in out. Now, how will I do this? How will I do that? No, go ahead and do anything and everything. Be careful, be cautious, give yourself good diet, and go ahead and do whatever you are capable of.
Okay, wonderful. Also, when we take the medications, do those medicines have any impact on our moods?
On our moods.
Yeah.
So if we are talking about hormone replacement therapies, rather they are good for mood changes. They are good for the climacteric symptoms of menopause, like as I was mentioning, hot flushes and excessive sweating, palpitation, all those things, and even the mood changes. So they have a positive impact. If the level of estrogen and progesterone fall in your body, then you are prone to develop certain emotional issues, which may be a passing phase, which may be a transition phase, it may go away, or it may last longer. So if it is lasting longer and if it is taking a toll on your day-to-day life, then discuss with your doctor and go ahead and take medicines. So either medicines or simple lifestyle modifications are going to help you. And yes, the medicines, any medicine that has an effect may have a side effect too. Not grossly, but yes, you need to see what other things you are doing, what other medications you are taking, what other lifestyle you are following. So it is not that they have a side effect for everybody, but yes, you need to see what you are looking for in terms of effect and side effect.
Okay. Okay, coming on to the last question for the session, how can one incorporate lifestyle changes to manage blood sugar levels considering the hormonal fluctuations?
That's what I mentioned. What you can do is monitor your blood sugar regularly. Either you can go for a daily prick blood check, the glucometer that we have at home, or you can go for regular monitoring. There are monitors available that you can attach on your body parts, and they keep measuring your blood sugar on a regular basis. If you feel that it is showing symptomatic fluctuation, which means there are times of the day when people say that I get up at 2 a.m. in the night and I have excessive sweating and ghabrahat and palpitation. So that may be a time when your blood sugar is falling. Okay, there is a phenomena that at a particular time of the day you may have a particular symptom. Then please mark that thing, make a note of it, discuss it with your doctor, and tell that okay, maybe this is the time when I'm having fluctuation. So you can arrange your medicine that way. If your morning blood sugar is high, then you can increase the dose of your night medicine. If your evening blood sugar is high, then you can increase the dose of your morning medicine, right? So you have to monitor your blood sugar more vigilantly. You have to go for a planned, structured lifestyle with good supplementation, healthy eating, regular exercise, and understand that menopause is the period when your hormone levels are falling, when you are prone to diabetes. So the word says prone. The ladies who are in the menopausal age window, they have a tendency to show, to unmask diabetes. Those who are prone to diabetes, they may develop diabetes. It is not a rule of thumb. All ladies who are going through menopause will have diabetes. No. But ladies who are prone, yes, they become more susceptible during these age groups. So be vigilant enough. लोगों को पहचानिए, timely recognize करिए that okay, I think this is not normal.
Yeah.
Let me go and talk to my doctor. That is important.
Absolutely. Perfect. Thank you so much, Dr. Puja. I guess everybody has got their answers and we do not have any more questions.
Thank you so much for having me. It was a pleasure joining your session and talking to you.
And the session was really informative, even for us also. It was really informative because our mothers are also going through the same, right? So we can help them a lot with that. Perfect.
Glad to
Okay.
hear that.
Before ending the session, I would just like to inform my audience that at THIP Media, we are dedicated to delivering expert health advices. And we would just request you to not go and check any unreliable source on social media. You can just follow us on our YouTube channel, and you can also join our communities and on other social media platforms as well. Remember, when you know better, you live better. Thank you, Dr.
Wonderful.
Puja. Okay.
Wonderful. Thank you so much. Thank you for
Bye.
having me.